Hello everyone, I'm Dr. Sri Banerjee, core faculty for the College of Health Sciences and Public Policy at Walden University, and I wanted to go over a novel data set. I usually talk about National Health and Nutrition Examination Survey, but this is NSOC, which is National Study of Caregiving, and sponsored by NHATS, and so this is a study by the National Health and Aging Trends. So the first thing I'm going to do is to tell you about each of these if you want to actually cite these. National Health and Aging Trends Study, which is NHATS, and NSOC is National Study of Caregiving. So these are both wonderful studies by the Department of Health and Human Services and multiple other agencies. What I like about NHATS is that there can be individuals that are over 65 and they have followed about 5,000 individuals over there, and the 5,000 Medicare beneficiary. What is interesting is that it's actually 9,000 Medicare beneficiaries. Age 65 and older, and there's actually complex samples survey that is outlined, and you can use this in SPSS or SAS. Both of them, hopefully, if you have a license in SPSS, and SAS is free. So it started in 2011, and then 2015, a lot more subjects were added. So for 9,000 there were more after that. And who is in the data and how are they followed? So it includes again nationally representative sample of Medicare beneficiaries age 65 and older, and so that's from the Medicare enrollment file. At the time of enrollment, eligible participants included people living at home and in various types of residential care facility, including assisted living facilities, nursing homes. So a lot of times their nursing home data is suppressed, and for example, if a subject moved from a residential care facility in wave 1 to a nursing home in wave 2, he or she has subsequent annual reviews done in the nursing home. So you can longitudinally take a look just at nursing homes. And you can also take a look at ethnicity. The first group of participants enrolled in 2011, again 2015 a bit more was added. There may be practical issues with acquiring the Identify Enhanced dataset. Actually had to create a login and password, so don't be hesitant to do this, as there's not much personal information that they use for public study, and this is actually outside source that gives a good broad overview. It also is follow-up interviews that follow the patient regardless of residence. So these are areas that are oftentimes neglected, which is why this is more of a social determinant of health. So there's extension. What is the benefit? There's extensive information on informal caregiving via this National Study of Caregiving. So NSOC is another one to look into. The content of this is NHATS. So these are the ways to cite it. Now, if you want to see the files, go in here. This is nhats.org, and then public use files. You can see SAS and Stata. Good thing about SAS is that you can actually import it, and you can actually open this in SPSS. And use the complex samples as well. So and something else I want to uniquely point out is that COVID-19, the SAS version actually has information on this. So here's waves 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. So there's 11 rounds. And just according to what I encourage you to do is go and look at papers that have cross-sectional. Most of this can be cross-sectional, but the power of this is that there can be prospective cohort study, which you can easily follow. So these are the types of data that you have. I hope this has given you a good synopsis of that. Thank you for listening.